Welcome to Chautauqua Books. Our guest today is Dr. Robert Burke. He is the Health Commissioner for Chautauqua County, and he has several hats, and today we're talking to him with all three hats, whatever those hats are. And our book, the book we're going to be talking about, neither one of us wrote. We both read it. It's called Betrayal of Trust, The Collapse of Global Public Health. And the author is Laurie Garrett. It's a huge book. It's 750 pages with the notes. Bob doesn't like it. I like it, so we should have fun with it. First of all, a quote. A quote from Dr. Bernard Pécule, I guess it is Pécule, who you probably know, who's the Nobel Prize-winning creator of Médecine Sans Frontières.
It's Médecins Sans Frontières.
Médecins, okay. And we'll translate that to Medicine Without Borders, or Doctors Without Borders.
Doctors Without Borders, right.
Yeah. And he says, in this book, he says, the push for record-breaking profits leaves us focused on 300 to 400 million people in rich countries. But on a human rights level, of course, this is unacceptable. And it seems to me that this book does say that record-breaking profits is causing a global breakdown in public health. Do you think what do you think?
Well, there's no question that the push of the developed world into using the greatest resource that you have in the developing world, which is most of Africa, parts of Asia, that the greatest resource being the human resource, using them as a means to produce at extremely low cost some of the goods, and mainly goods, not services, that we benefit from here, has created enormous problems. And some of those problems are public health. Some of them are economic. Some of them are just problems of human misery. So from that perspective, there's no question that it has put enormous strain on those very fragile communities without much infrastructure, including public health infrastructure, and the pollution and a variety of other things that go on because of the kind of industry that we seem to have gotten rid of, the Rust Belt industries that no longer exist here, or exist in much more genteel fashion than they did at the turn of the century here or before, now exist in those places without most of the constraints that we've placed on them.
They were saying they exist?
They exist there, much the same way they did here.
You're talking about Africa or whereabouts?
Africa, Asia. And what we're seeing is issues of pollution that we no longer tolerate here, that are commonplace there. And
do we not tolerate that pollution? I mean, for example, from my understanding, Chautauqua County is heavily polluted from the Ohio Valley heavy coal.
Oh, you mean from air pollution?
Air pollution.
Oh, of course.
Yeah.
But that's a little more subtle than what's going on in those places there, where the pollution is also quite visible.
Right.
Disposal of waste materials directly to the ground, where here there's some degree of attempted control. Most of what we drink, although it may be contaminated in subtle ways, there's no subtlety in what's going on. Raw sewage running in the streets, raw waste coming out of factories. It's far more blatant, and you can get away with it there where you can't here. The dumping.
It's one of the reasons why the whole process of globalization is working, isn't it? Is because you can get away with violating environmental laws since they don't exist or are minimized.
That's another story you want to.
Well, I think that's
I understand.
I think that's part of this story.
I understand that. This story, though, has to do with other issues with respect to public health. This being one of them. There are numerous other issues that the author touches upon, which, although there is a germ or a kernel of truth and validity, there's the style of the book just wasn't what I enjoyed.
Okay, Bob. So you're talking about that you have problems with the style as opposed to the content?
I had a lot of problems with not only the style but the content.
Okay.
The style. First of all, it's a series of vignettes or short, fairly graphic descriptions of public health disasters that take place or near disasters that take place in far-flung areas of the world.
Right. Well, let me name a couple of them, okay? Basically, it starts off in, I think, Zaire
Right.
with Ebola virus.
Ebola virus, right.
Then it goes to India with
Right.
pneumonic plague.
Right.
Then it goes to the Soviet Union with the total breakdown of public health
Right.
there. Then essentially it goes to Los Angeles.
Right.
And then to Minneapolis.
Right.
And then to New York City or
Right.
something like that.
Right.
And that's pretty much it, except for the terrorism,
That's right.
the business, which is
Oh,
sort
right.
of stuck in there. So, you want to finish your thought, or do you
Well,
wanna start another one?
No, let me finish that
Okay.
one. I just, from a very personal point of view with respect to the type of reading I like to do,
Okay.
and the way a book is shaped and put together.
This is definitely shaped, very
Yes.
heavy.
Yes.
It's big.
It's big, and not only is it big, let's go to the Ebola story.
Okay.
I spent 3 years in West Africa.
In Cameroon.
In Cameroon. Fortunately, never saw Ebola. Saw yellow fever, saw all kinds of other epidemic disease. And of course, each of those outbreaks has a very human face. When you get down to ground zero, where the bomb goes off, there's a human face involved here. And what I found most distracting from a public health professional point of view and from the reading that I wanted to do to look at what this author was trying to say, I found these stories which she elaborated quite significantly, going into the personal lives of folks and little village stories and putting a whole human face to this at ground zero. After a while, I got a little tired. I found it quite tiresome. And
Well, let me tell you, I agree with you in one respect. I kept losing this book. I mean, I would read it. It's long, it's 700 pages
Right.
plus, and I'd put it down. And I thought, I can't find it, and I think there was something going on because it's just hard. The anecdotal material
Right.
could be synthesized much tighter.
oh, that's
no
right.
question.
And that's probably the best description. It lacked that tightness that happens when people write in the style that I enjoy reading, which is you get the message, it flows, it brings you from point to point, and you gather the big picture.
But let's just take a look at the Soviet system for a start. I mean, the India story is just extraordinary in my view,
Right.
and certainly the Ebola story
Right.
is there. But let's take a look at the Soviet Union.
Right.
You have a situation where essentially an authoritarian system, the health system worked to the degree that it did,
Because it was
authoritarian.
controlled. Right.
And it said if you have tuberculosis, you go to the sanitarium
Right.
and you don't come out
Right.
until you're free of bacillus or whatever.
Which is about what we do here, though we don't do it
Not
in
as
that
crudely.
fashion. That's
Right.
right. We do it a little more elegantly, right?
Yeah.
Right.
And that was the same with everything.
Right.
I mean, it was just basically lock them up and if
Or
they're powerful.
aggressively go after the spread of disease.
Yeah.
You know?
But I mean, they had the problem of Lysenko and this whole
Oh yeah,
nonsensical.
that's another story.
Yeah. But that's part of the story.
I know, but that was just the fabrication of a type of theoretical approach which met the party line, so they just
Lysenko you're talking
yes,
about.
yes.
Okay, right.
But in general, what has happened in the Soviet Union is basically just a microcosm of what has happened globally there
Right,
with
yeah.
respect to their economic system
Right.
and their social fabric.
Right.
It just imploded under the weight of everything else that went on, and they are slowly trying to put that back together. The problem being, it is a monolithic structure, huge, and to do that, it's a difficult issue.
Do you think it's possible?
Well, if you look at England
back
at the
together?
moment, if you look at England at the moment, undergoing significant public health crisis with respect to first mad cow disease, then this latest hoof and mouth. Initially, it looked like the place was going to come unglued with what was going on, the impact on their tourism and on everything else, farmers going broke, and they're managing it because it's a country that has 1,000 years of history that has led them along a path, and the path has always been the same. It's been one of progress along a certain
Well,
logical...
They do have a history of public health.
Yes, of course they do.
And as the Soviet Union...
A very good history.
Yeah, right.
Actually, that's in many senses, the founding fathers of public health. John Snow came from London with his discovery of the mixing of sewage and water in the London system, which led to cholera in certain parts of the city and those parts that weren't
Well, let's
supplied
get back to the Soviet Union real quickly. And that is, you have a multiplicity of drugs that are essentially, one of the things that happened in Russia in 91, 92, was an extraordinary flight of its anybody who could get out did. And you know this personally. I mean, one of your doctors came from there.
Right.
So essentially, you have people self-medicating with a lot of medications that are improperly used.
And so you end up with multiple drug-resistant germs. Sure.
And this stuff is not going to be isolated to the Soviet Union. I mean, it's already eating into Finland and other areas of the world, certainly.
But you know, the world literature is not at the moment overwhelmed with this.
Tuberculosis, cholera?
Yeah, but again, this is not happening at the rate or with the disastrous effect that is portrayed by Laurie Garrett. I think for sure.
Laurie Garrett, you know, is not making up these quotes. I mean, some of these quotes are just coming from extraordinary.
I understand that. But on the other hand, if you look at the present-day literature, there is, in spite of her allegations that there is a lack of global control over what's going on, there's a fair amount of communication between the public health systems worldwide. And although these are worrisome issues, extremely...
How worrisome do you think?
It can be extremely worrisome in some cases, but on the other hand, some of the countries that border on Russia, for example, some of the countries that receive folks coming out of Africa, have fairly sophisticated systems, and sure, the risk of someone coming off a plane in New York City, as she talks about, and things happening is there. It's not happening on a regular basis, or if something does happen, there's a fairly good and rapid response that seems to, if you look at this, there was a case in Toronto of a lady who had come out of Africa and had a very bizarre hemorrhagic
but that was
fever.
Proven to be not hemorrhagic, was it?
Right, but initially the look was that this could be something that had some significance. And that information took a very, very short time to coalesce around this patient with the reporting and the internal and external communication, so that that was pretty well sealed off, at least, and the information around that got communicated fairly effectively, so that agencies that are in the passive and active surveillance of the potential for this kind of outbreak did a fairly good job at notifying emergency rooms and physicians.
That's, you know, it's great when it works, and it obviously did work in that case. There are other instances, for example, just jumping around a bit, the raspberries from Guatemala. I mean, you've got salmonella outbreaks. Just a tiny, I mean, the thesis seems to be, in much of the health, and you correct me with this, the thesis seems to be that among the general population, I think, who's insured with some sort of medical insurance, that if we can just take care of ourselves, if we can just maintain our insurance, if those other people, you know, die of disease and whatever, that's their problem. But it's not, because, I mean, even from a very selfish standpoint, those people are growing the food
that we're eating.
I
understand where you're going with this, but on the other hand, the initial premise is we have to look after ourselves. The second point is we have to provide the technical assistance and the efforts to help improve those other systems. So
sometimes they don't even exist. I mean, India, for example. Well, the case of India is a very interesting one. I mean, a city of roughly a small city in India, 300,000 people. There was an outbreak of pneumonic plague. It's airborne plague, right? The public health system was so decimated that there wasn't that anybody who, the only thing that was left practically were private doctors.
Right.
And they got out as soon as they knew there was a pneumonic plague without even telling the general public.
Well, that's the story she
Is not
portrays.
true? You think it's false?
I think the healthcare system in India is remarkable for what it can do.
Especially what it could do in the past.
Dealing with a population of over 1 billion people.
That's certainly true.
And there's only so much that you can, that you can deal with.
What do you think of the whole phenomenon? I mean, it seems to me that we just went to Quebec City and looked at essentially the globalization process there. In a
beautiful place, isn't it?
Oh, it's
Quebec
beautiful.
City. It's just gorgeous.
Yeah, it's beautiful. You spent a lot of time there?
When I played hockey at McGill, we used to go and play in the Winter Carnival tournament there, and it was just, Winter Carnival is the time you should go. It's just,
really?
Spectacular. Plus, it's a beautiful city anyway. It's got that old world feel to part of it.
You bet. Ersatz, but old world.
Yeah.
Okay. At any rate, the globalization process is going on is that the two primary sectors that seem to be privatized most are education, public education, and health systems. And that whole shift of essentially downsizing public health is going on a global basis. It's going on obviously in the United States. 45 to 50 million people don't have any health insurance whatsoever in this country. That's relatively...
But when you say, I think I want to differentiate between the public's health, which is what you're talking about.
I'm talking about both things.
And public health, which is a fairly vibrant, actually, community in the United States, which is growing with respect to...
It is?
Well,
I mean, Los Angeles, there were 9,000 people fired from the public health system. But the clinics in Chicago were basically shut down.
But that's the privatization of the... You see, public health, it depends how you define public health.
Okay, define it.
And I think that in the United States for a period of time, the public health system also ran a clinical side, which provided direct health services. I think traditionally across the world, public health has been much more esoteric in its approach to health in general. They are the bug chasers and the epidemiologists and the people looking after water supplies and sanitation and sewage and your restaurants that you eat in, and much less involved in the direct provision of care. So some of the downsizing that we're seeing, and we downsized here in 1987, I took a lot of grief for that. We made a decision to get out of the provision of direct care for elderly folks at home, home health care. And the reason for that was that it was costing us more money than we were getting reimbursed, and there were a significant number of private providers, much as you're alluding to the privatization here, who were able to do it. But we did such a good job. Our nurses were great. They spent 2 hours per visit with everybody, and everybody loved them. And it was not cost effective. And there were people out there who were, from a business point of view, able to run it more efficiently. And we have dozens of providers now. We have more home health agency care, more health care at that level going on than we could provide.
But Bob, look,
so we downsized.
But look, what's the situation with a person who can't afford that health care? I mean, I know of instances where people just cannot afford the kind of health care that they would have gotten in a public health care system.
But now let's go back and talk about what the vision in this country is of public health, or what it is, what it appears to be heading towards, and that is the orchestration of a series of interventions with the community at the base level, where the community looks at those kinds of things that they can do to maintain their health, what kind of policy and actual practical matters the community can do on their own, or at least intercede on, that does not require a system to provide. Now, that can be walking programs for people, the basic kinds of things that people can do for themselves that are
But a lot of people are being asked to do a lot of things for themselves. Taxes are going up. The time it takes to...
Fella, you haven't seen taxes yet. You may have tried to see them when you were in Quebec, but I can tell you, I was taxed at 62% at the marginal rate. I mean, here, we're talking 37%, and people are squealing. I mean, taxes are going up here.
It has something to do, though, with service delivery.
Oh, of course.
Don't you think there were certain more services that are available in Canada than in
you know, you're talking. See, we're both sitting on the same side of this. I'm just trying to refute one side of this. I am a firm believer in a single-payer system. I grew up in it. The benefits of it were tremendous. One quarter. I just was visiting some of my friends. I was in Ottawa this past weekend with some of the fellows I played football with in college, many of them physicians. Their cost of running their office is 15% to 20%. Ours is 60%. And all of that cost is in billing and administrative costs that they don't have because the government does it. But what you get here are people screaming about government control of this and government control of that.
Tell me, don't you have a kind of, I won't use the word class, but at least a different level of money? I mean, I hear a lot of people saying, well, you know, I'm from Canada and I can't get my operation, and so I'm going to the U.S. and get it where I can get it right now. But the waiting line, if you read this book, and I assume that their data is correct, she's quoting other people, she's not making this stuff up, is that for some very simple procedures in Los Angeles and some of the other larger cities, a waiting line can be over 2 years for a relatively
but it's very interesting because when you, to pick up on that point, when you talk to most people down here who are fairly rabid in their approach to what they think the Canadian system looks like, they're always quoting the fact that people are waiting in line for anything serious for significant periods of time, as opposed to here where you can get everything done immediately.
Can you? Sometimes.
Well,
especially
it depends.
You have money.
It depends. On the other hand, the average Joe in Canada can have access to his or her primary physician fairly rapidly. So the base of the pyramid is fairly wide open. And yes, they do crimp as you move up. If you want a bypass in Canada, you probably have to wait for it because basically the data sets are still out there as to whether bypass in a large population has any value at all.
What's going to happen? I mean, let's set this up first. Probably.
Okay.
Okay. Canada is in the process of much of there's a large effort. Day was a part of this.
Yeah.
Day, who's ran.
Yes, Stockwell Day. Yeah.
Yeah, Stockwell. Doris, they call him up there. The process of essentially dismantling its public health system,
Sure.
and the thrust is to do that.
Well, it's healthcare system, different than public health
healthcare system.
Yeah.
Okay. And the thrust largely is that money is looking for a place to maximize its profit.
Sure.
And it sees healthcare as one of those places, along with education. Education is just for sale. You can essentially buy yourself a university and teach whatever you want, irrespective of the public.
As you can here.
Yeah, as you can here, of course, of course. And that process, will it happen in Canada?
I don't think so. I think the healthcare system, which I remember as an intern, I was there the first day I enrolled in Montreal General Hospital. The first day
another
that system,
beautiful city.
Yes, the first day that system rolled into effect, I was October 1st. I was there, and we had lines of ambulances outside our emergency room because all the hospitals closed. The physicians went out on strike, the specialists did. And we were one of the only 2 hospitals in Montreal that were open. And we just had people lined up day and night for a couple of weeks until suddenly it stopped. And then everybody went back to work and the system started to work. The interesting thing...
Great story.
Well, the interesting part about it all was that it wasn't all that bad. I remember we griped a little bit about this and about...
You thought you were going to get much richer than the possibilities.
Well, it was...
I mean, the young interns were thinking, whoa, I'm here, I'm a government employee now.
Well,
almost.
Almost. But it's just a different mentality. Here, of course, it's a privilege, not a right. In Canada, it is a right to get health care. Now, how the health care is shaped, I think if you want an MRI in Montreal, there are probably only a couple of machines. In Chautauqua County alone, there are, a number of machines, and access to them, though being squeezed by the healthcare industry, the payers, access to them is much greater. But how many people actually need an MRI? Most people need prenatal care. Most of them need pediatric care. Most of them need basic medical care. And that the socialized systems or the nationalized systems provide very well.
Yeah.
Canada, unfortunately, suffers from, much like this country, short-sighted politicians. The system spends probably $2,000 per year per person. That's about what it does. And that number is just a relative number, maybe 2,200 or maybe 1,800. Probably should be spending 2,700. Here we spend
4,000?
2,800 to 3,500 something. We spent $1 trillion, okay? Our national budget was $1 trillion. We spent about 300 to 400 billion. And I don't know what it works out to, but it was... Well, anyway, the point is, we overspend and it's malspent. It's malutilized. It's most of the money spent is in the last 2 weeks of your life. You know, you're 80 years old on a ventilator in an ICU. And that's a lot of money is spent in the last 2 weeks of your life. And yet we have women who can't get prenatal care. And so, again, both systems function.
Do you think that a relatively healthy population can exist where 45 million people have no health insurance and rely on emergency room for their primary care?
They seem to be managing to do that, but there is a reason for that.
And the reason is?
The reason is we are very resilient organisms. I'm going to give you a lesson in statistics now. It's a very simple lesson.
All right.
When I went to Africa to work, I remember looking at Cameroon where I was going, and the average life expectancy was 49. And I said, my God, that's low, you know. The average life expectancy in the United States is 72 if you're male, 78 if you're a female. And so I went there thinking, boy, not going to be too many old folks here. You know, everybody lives to about 49.
The children are dying.
The children are dying. By the age of 5, 50% of them are dead, and that weight of expected life brings the average weight down, the average length of life down. But if you get past 20 in Africa, in Cameroon, what's your life expectancy? It's 68.
Yeah.
With $1 a year being spent on you. So we're very resilient human beings.
When were you in Cameroon?
74.
Don't you think? In 74, it's 30 years, almost.
Yeah.
Don't you think it's changed quite a bit? I mean, I was in Africa and earlier than that, and I don't think the Tanzania.
Yeah, but you're talking about AIDS. You're talking about AIDS.
I'm talking about AIDS and opportunistic infections.
Of course. But what the premise I'm making here is that for the most part, folks here, because of immunization and the most important thing we have here is walking in and flushing your toilet or turning a tap on. That's the most important public health event that happens in this country 500 million times a day, 1 billion times a day, whatever.
Let me ask you this. What did you think of her description of what happened in Minneapolis? Minneapolis was...
Right.
Not Minneapolis, Minnesota. Yeah. Had one of the best public health... Well, Minneapolis too, but Minnesota. One of the best public health systems dismantled. Right. It's almost gone. And that happened before Jesse Ventura. Even.
Right. But on the other hand, what happened... The event that happened, you're talking about cryptorganism. You're talking about
cryptosporidium?
Cryptosporidium, is that what you're talking about?
No, I'm talking about essentially dumping a large number of the relatively poor, essentially
you're talking
minority,
about that side. Okay,
yeah,
I thought we were
off of access to public care, public health care.
Sure.
I mean, that is sort of illustrative of the problem in this country.
We're talking, see, again, I want to get back to the definition of public health. The public's health, as you view it, is the total picture, which includes the base public health effort, which is, pardon me, water, sewage, immunizations, the whole package, disease outbreak, bioterrorism now, a variety of other issues. Then add to that access to health care, hospital beds, maternity care, prenatal care, child care, all that, plus emergency care and the emergency network system. That may be at risk. the basic public health function that goes on with respect to monitoring the air and the water and the disease outbreak and everything else is fairly sophisticated and is a fairly well-integrated system, in spite of everybody's misgivings.
Okay, I can see the point.
I understand your point, and I agree. This healthcare system is a disaster. It is a non-system. It is the only non-system left in the world. There is no continuity across the whole system. It is made up of me, private doctor, calling Joe Blow, private doctor, about a patient, and us relating things, and maybe the patient having some continuity of care that way. But if you leave and your HMO here doesn't have coverage on the West Coast and you go there and you get sick, what happens? And there are issues where you may not get care because you can't pay. That part of it stinks. But
stinks, and it's going to be devastating as soon as some serious problems break out, and they are breaking out,
Well,
I mean, tuberculosis is not unknown here. We have
tuberculosis is
pneumonic plague has reached minor, but I mean, you wait. In California,
they have occasional cases of plague in this country every year.
Sure, pneumonic we're talking about.
Right.
I mean, Proposition whatever it was 728 in California took everybody who was an undocumented alien off, and so the general public of Hispanics don't go
for health care
because they'll be questioned, interrogated, even if they're citizens.
Of course, and this is but your point again is getting back to the part of the healthcare system in this country, which is its worst, and that is the inability to provide basic, not public health, but basic health care, which I would call just access to the healthcare system for preventive health, for healthcare maintenance, for those kind of things that we expect. Every woman who's sexually active should have a pap smear every, and all those things, mammograms and proper age.
Even when you have, say, Blue Cross Blue Shield, many of the illnesses that affect women are not covered. This is extraordinary. What are the poor who don't have any health care doing for those things?
I understand. They're doing nothing.
Yeah.
They're doing what people do.
This is murder, do you know?
Well,
that's what she used.
They're doing the same
Paul
thing.
Paul DeCreef. How do you say that? DeCreef. Do you know
DeCreef.
DeCreef. Okay. Yeah. Paul DeCreef calls it murder. I think he's right.
It is tragic that the richest country in the world, with the most per capita wealth, the highest, GDP, cannot come to grips with the concept that healthcare is a right for every citizen. The interesting thing is that they have no problem in coming to grips with the fact that public education is
public education is going to, Bob.
Well, no, but I'm talking from a theoretical point of view.
Okay.
Every child in this country, if they live on the city block down there, has the right to go to that school. Okay, in theory.
In theory.
Okay,
right.
But that does not. Okay, but that doesn't exist for healthcare.
In theory, it doesn't exist. In
theory, it doesn't exist. Now,
that's extraordinary, isn't it?
That's extraordinary. That people are willing to pay taxes. They gripe a little bit, but they're willing to pay taxes so that kids go to school, public school. No one is willing to pay taxes so that kids or adults can have health care, which is what happens in those countries that are socialized.
Why do you think that is? I mean,
I have no idea. I have no idea. It's historical. It's the.
I'll tell you what I think.
Go ahead. Okay. I knew you were going to, so go ahead.
Okay. Well, wait a minute. You were about to say, so I'm not going to. Go ahead.
Go ahead.
All right. If there's money to be made, one of the chief proselytizers for essentially moving public responsibility away from certain areas is the press. The press is highly critical of government. Any sort of government, the press goes after. Well, the government should be gone after in many cases. I mean, when they essentially hand over major much of the block grant, for example, block grants that went to health care, those were shifted straight to corporations. Straight to corporations. IDA grants is nothing but a taking of that money, shifting it to corporations, so it will stay in Chautauqua County.
Let's look at Well, let's get away
Okay.
from your political diatribe for a moment.
Yeah,
and go
no
to
diatribe.
reality.
These are just
I
facts.
know, I'm just joking.
Okay. Just want everybody else to know that.
In the Canadian healthcare system,
Yeah.
which is a true system, run province by province, but it's a true system in many
Okay.
ways, 92.5 cents, or 91.5 cents of every dollar.
Let's get that straight.
Yeah,
Come on.
91.5 cents of every dollar.
Is this a Canadian dollar?
Yeah, so it makes it about 34 cents, but
Okay.
it doesn't matter. 91.5 cents of every dollar spent on healthcare goes to direct provision of care. It costs, it's got an operating cost of 8.5%. That's remarkable. That's a government providing. Now, people say, yeah, but they don't provide them with anything. If you look at life expectancy, or not life expectancy, but infant mortality.
Indebtedness is one of them.
Okay.
You know?
But anyway,
Yeah, go ahead. You're right.
in the American system, if you go and talk to any of the insurers, they're talking about medical loss. Medical loss means the amount of money of every dollar is spent on actual provision of health care, and they're struggling at 78 cents, something like that. Actually, Medicaid and Medicare, which are government-run, are extremely efficient with respect to paying up their bills and how efficiently they run. And they're up in the high 80s also. I mean, they really do a very good job at turning those dollars into actual provision of care. So what I'm trying to say is those people knocking government for running business should probably look elsewhere when it comes to the healthcare side of things, because those are actually fairly well run and fairly tight with respect to the, sure, there's fraud. There's no question in each system there are people gaming the system, but ultimately these people do a pretty good job. Now,
Well, I'm not saying
they are constrained
I'm not-
by the lunacy that goes on in Congress and in the Senate with respect to legislation and whatever else that hampers the way healthcare is managed. But still, all in all, the government side of that equation is actually fairly well run. Unfortunately, healthcare in this country is a business, and as we know from previous forays into the capitalistic process, there are people who don't survive the process, and we're calling those 40 to 50 million Americans at the moment who are losing the potential for accessing health care, or have
Right.
lost it for the moment.
It's very, very short-sighted, isn't it?
Of course it is. It costs you more to do that than it would to provide the health care for them.
Absolutely.
Because see, the funny thing is everybody deals in this country with concrete examples, and almost every person in this country, it seems, or every adult drives a car. And for many of them, they would never allow that kind of thing to happen with their car. They change their oil religiously at 3,000 miles. They rotate their tires. They do everything else. Well, they're allowing people to function out there in the world without that maintenance happening. And what we do is breakdown maintenance, which everybody knows for your car and for humans is usually far more expensive. And with
Not only, I mean, it is going to cost a great deal more.
but I mean expensive in the global sense.
Yeah,
It's
right.
there's a lot more grief involved with
right.
it.
Yeah, but and also there's this notion, I think, that's extant, and that is that, well, I think there's a kind of neo-Malthusian notion. I wanted to ask you about that. What do you think about that? Let me explain what I mean.
Sure.
The question. And the question is, there is a response to say, well, basically there are too many people. They're dying, but hey, Malthus, a Reverend Malthus said, that's the way it goes.
That's right.
I mean, they're just going to die, and they should die because they just
It's God's will, basically.
God's will, and they produce themselves, and there's not enough food.
Right, and I know there is a certain sentiment about the AIDS epidemic in Africa, which runs along about the same line. Well, look, all that promiscuity, that lifestyle, having 4 wives and 3 girlfriends, and all this, heterosexual, Sodom and Gomorrah that goes on over there, and now the spread is just, and that's what's going to happen, and we can't do anything about it. And you know what? We can't. I mean, numbers, they've reached critical mass in a lot of those places. When you're running at 30, 40% rate of infection.
How's the Cameroons doing?
The last number I looked at, the population is about 30 million, and they had, the map said 400 to 500,000 infected. That's nonsense. some of the prevalence data that's out there, looking at some villages with 30–40% of the population, adult population infected.
And this is a phenomenon that produces psychotic, totally unhealthy children. I mean, if they survive, I mean, if they don't have, if they're not HIV positive, because they are raised without adults, without even brothers and sisters.
One of the areas that I found, getting back to our
massive
book,
war. Okay.
Oh, well, there it is.
What?
One of the areas that I found was not really dealt with. It has to do with the issue of warfare.
Oh yeah, that's right. She didn't really deal with that.
That's right, because that is probably, if anything, one of the threats that we're seeing that's really become. I know you were involved in Africa. You had a good look at that side of things, and I was very fortunate. I never did. Though when I worked in Thailand, I was dealing with Cambodian refugees coming out of the Khmer Rouge era. And it was pretty ugly. But there appears to be at the moment across Africa a number of hotspots that may have been there before but weren't that apparent. But now with the ease at procuring weapons, you're seeing extremely well-armed militias all over the place.
Or many of them children.
Children, yes, exactly. Engaged in warfare for years. Absolutely, well, generations. And this
What do you think should be done?
Oh.
I mean, it seems to me that one of the things that should be done is that the UN should be taken as a serious, the World Health Organization, and the UN should be taken as serious organizations, and a tremendous amount of effort being put in. And that's what the Doctors Without Borders is doing in part, isn't it?
Well, the Doctors Without Borders is a process where physicians attempt to do the work that physicians should be doing without respect to political boundaries, and attempt to bring health care, at least in some rudimentary fashion, into these absolutely decimated areas.
Do you have access to them? Do you know them?
Sure.
Do you know members? Yeah. Do they speak here? I know, because one of the things that interests me especially is that they are not restricted. Medical doctors for the Peace Corps, for example, were they were cautioned about what you could say and not say. And these guys are not cautioned. Men and women.
Because there's a political, well, there's a geopolitical nature to the work they do, and that is they are trying to maintain peace, which is an interesting phenomenon, which is kind of foreign to a lot of the things that we do. I am appalled at not only this country, but many of the European countries' position on what's going on in these places. That absolute slaughter that took place in Rwanda, everybody just ignored it. The bodies were floating too deep in the rivers. 1 million people slaughtered, and slaughter is the only word you can use because it was done in the most brutal way, and we just kind of ignored it. Yeah, I think because there wasn't much economic, interest for us to be involved.
Extraordinary, isn't it?
Well, it's extraordinary.
There's a really good book on it. It's called "We Regret to Inform You That Tomorrow We Will Be Killed with Our Families." Do you know the book?
I don't know the book.
It's an excellent book.
Well, it's a shame because that is also one of the greatest. See, I think the other public health problem that we have, which again wasn't described here, is the what is it, 10 million landmines that are out there that are blowing legs off people all over the place, that this country has yet to sign, a treaty on, the global treaty on.
Well, you want to make this 750-page book longer.
Well, she could have cut out half the BS she had in there on these little stories.
Well, I agree. I agree. I wouldn't recommend to anybody who really, unless they really are very interested in the collapse of global public health.
Well, but you see, I think...
Because she could do it in about a third.
Yes, except for one thing. If I take myself out of the past experience of my life, those stories about those little villages and, Zaire and Russia, wherever else.
Russia, yes.
They're quaint little stories, and you put the hook into you, and if you don't know much about it, it gives you a little flavor, local flavor.
No.
But from a public health official point of view, and I was at the American Public Health Association national meeting last year, and people were, this thing was being bandied about as one of the great tomes of, and I couldn't figure it out because the book did not do it for me. But I've slept on pillows made of, formed mud in huts, as much as you have in the middle of nowhere, and
well,
I have that flavor already, so maybe it wasn't something that I wanted to.
The thing is, Bob, what we are seeing right now is privatization of much of the previously public sphere, education and water, for example. When water is privatized, that's a big thrust to do it in Latin America, and I suspect wherever a buck can be made, clean water is not going to be available when essentially whatever to the poor who can't afford it. And of course that's the case in much of India, one tap for a village of thousands.
Right.
With the essentially dismantling of the public health concept systems, whatever, we're going to see massive outbreak of communicable diseases with no treatments available to the multiplicities of new variations, viral and bacterial.
That's a premise which I know Ms. Garrett makes, and in many cases
she's not making this alone. She's quoting.
I understand that.
People
I understand that. But like anything else, there are thems that says yes and thems that says it'll never happen, and somewhere in between lies the truth. I think this is a very interesting time at the moment.
Sure
when I
is.
say interesting, it's in quotes. A lot can go wrong. I think one of the things that you and I both lived through was the specter of waking up one morning with a mushroom cloud out there, and of course that still exists. But we were
the nature of the mushroom has apparently changed to biological warfare.
Of course, but I'm saying I can remember, just always at some point in a day or a week, having that thought in my mind that, this looks a little dicey here, and there are people with their fingers on the trigger all over the place. And there were moments in history that we would probably do better not knowing about, where it was closer than we thought for people to think that was the only option. And yet somehow we muddled through it.
Well, we didn't quite make it yet.
Of course.
I mean, the Soviet Union, rather the Cold War came to a collapse, the Soviet Union collapsed, and this country is in the process of essentially privatizing in the same way the Soviet Union is.
And there are 10,000 warheads sitting here, and there's 7,000 sitting over there that are for sale probably.
Yeah.
I understand that.
Let me. You're talking about terrorism, botulism for sale or whatever. The Aum Shinrikyo or whatever it is.
Aum Shinrikyo.
Rikyo.
Yeah.
These guys had a war chest in Japan, a highly religious sect of some sort, fanatics, and they bought all of the expertise and the botulism and whatever else, sarin or whatever.
Sarin, yeah.
And it was just readily for sale.
Right.
Similarly, similar things are going on.
And they killed. Where was it?
I don't know, 300, I think, or something.
No,
5,000 were sick.
5,000 were sick, and they killed 8 or 10 or 12.
12,
okay.
That's what it was. Right?
Okay. And what did that prove? That proved that, yes, you can do it. And that's a very sophisticated group of people who are fanatical. And they did it, and yet within a very short period of time, the thing was, the system, although it bulged, contracted back down and held the losses to an acceptable number. How's that? The collateral damage was acceptable.
Well,
what are you supposed to do? See, the problem that Ms. Garrett is talking about, and she spent some time talking about Margaret Hamburg, who was the commissioner for New York City, and the issue is talking about what happens if a plane comes in. How can you guarantee that someone is carrying, has got Ebola, doesn't make it through, and the system, to quote the folks locally, ain't perfect, you know, and it's far from perfect, but it does have a certain level of surveillance and resiliency that it will give and then respond. And the giving is going to probably create a certain acceptable number of casualties that you will not be able to stop no matter what you do. And at that point, it will shrink back down and deal with this.
The thing, to expand on that a little bit or whatever, that's because essentially we're looking at a system right now that's relatively
intact
in Latin America, in Europe, and even in the Soviet Union. I mean, relatively intact. That's not going to last. There's nothing.
Well, the premise is that it's not going to last.
Yeah,
we haven't seen that yet.
Yeah.
See, the difference between you and I is that I don't have the same crystal ball you have. I'm not sure that things are going to just fall apart.
Well, I'm not sure either. All I'm saying is the probabilities are such that you have, when you take away people's access to clean water, that's a huge...
Of course.
And when you do it to the poor,
of course,
who are living monoculture, I mean, they're exporting bananas, et cetera, et cetera.
I agree.
We've got a big problem down the road. I
agree.
And it's time to alert ourselves to the nature of this problem.
No question. And there are people thinking those thoughts.
Yeah.
Whether they have the voice. Whether they have the voice is another story.
Yeah.
And whether
Who's
they have
thinking those thoughts that are most interesting to you?
Oh, there are all kinds of... I can't give you names of most interesting people. I'm talking about in the public health community as well recognized that you must ensure safe water. Most of what I did in Cameroon had nothing to do with dealing with human beings. It had to do with people going out and protecting water supplies and sanitation.
That was essentially the Peace Corps, too. I mean, the Peace Corps, much of it was doing...
We won't go into the work of the Peace Corps in Cameroon. How about that? That would be another story.
Well, yeah.
But basically, water is essential, and protection of water supplies is essential to probably reduce infant mortality and improve the quality of life and health in those communities. It is the thing that you can do the simplest, the cheapest, and have the greatest impact.
And we're going in the opposite direction.
Well, that's a question as to whether we continue to pursue this course or...
Globalization, it's called.
Well, you're tying those two together, and I'm not sure that necessarily has to be, because of one thing. One of the areas that you need to... it's one of those greedy points that's very funny, but let us say globalization takes us to where we're going to put in a factory or something in some third world or developing world country. And we begin to create a situation which is not in the best interest of the health of those individuals. Initially, that will be tolerated until such point as you arrive at the I don't know what the break point where you have to decide whether it's in your best interest to make an investment to protect that workforce because they are a valued asset.
Who's going to make that?
Probably not the country, the host country, but the multinational.
A case in point, we haven't got much time left, and I have a couple things I wanted to do, but speaking of Mexico, I think you were referring to Mexico and so on and so on, with water. I don't know, maybe you were or not, but anyway, you have a situation with Chapter 11 on the NAFTA, essentially the new NAFTA, which is now called the FTAA, is that corporate rights supersede governmental rights. So essentially, if a government wants to protect its water reservoir, for example, but the corporation decides that they're going to exploit or put an aluminum mine on that water reservoir, aquifer, they can sue and win, and the health of that country is up for grabs, and that is essentially the nature of the legislation of the World Trade Organization. That's where we're going right now. I got a quote for you, though. I want you to respond to this. I like this. It's Aristotle. It's in her book. It says, if there are differences that are overwhelming, you either have to get rid of those disparities or get rid of democracy. That's Aristotle. I mean, that's 300 BC. Not bad.
Not bad, yes. Good clarity of thought.
Yeah, right. I want to read another one by Paul de Crieff. It says that Paul de Crieff was a biologist and a writer, as you well know, and he says that science is really the right of all humanity. It should be owned by humanity, by the living, by all who, half dead, have a chance for life. Science has a right of all humanity. We're essentially getting away from that, aren't we? The science.
It's kind of interesting because in the initial heyday of science, that was what we saw. Right. You know, this, even though there was privatization going on,
and there was authoritarianism.
Right. The great inventions, the light bulb, the electricity, the whole business. Yeah. There were tremendous advantage points for the total society. And now, of course, you look at this whole, you know, all these issues, every new invention that comes out or scientific discovery where people are claiming the rights to, including cloning. I go on and on and on. There's this
privatizing.
Privatizing. Yes, I agree. I agree. The question is, does your premise or Laurie Garrett's premise continue, or at some point do reasonable folks say, this doesn't feel right, let's move a little bit this side and see if we can't steer a better course? Yes.
Yeah, right.
At the moment, from the looks of it, with respect to the recent decision based on the Kyoto Accord and all that, it's not very promising.
Right.
But remember, leadership in this country changes every so often, and people have to, you know, go with what the flow is. And at the moment, the leadership seems to feel that privatization and the rights of individual corporations is paramount to drive the economic engine of this country.
Right. And the devil take the hindmost.
And that's right, and that's pretty scary.
And the hindmost is probably 85% of the world's population.
That's right.
Yeah.
But that's been that way with this country for a long time.
Yeah, right. Well, we're just about out of time. We are out of time. The book we've been talking about is Betrayal of Trust, The Collapse of Global Public Health. It's 750 pages long. It's 500 plus pages of reality. With the notes, it's that other. I think it's worth reading, but it's a huge tome, and it could be cut in about a third and would have been a much better book. And it's available all over the place, I'm sure. Bob, your last comments on it? You got about 10 seconds. I left a great amount of time for you. 9 seconds.
Didn't like it.
Okay. You think it's a good story to read?
Oh, I think it's a good story for people to read. Personally, I didn't enjoy it.
Not stylistically up to your standards.
Well, just not stylistically up to my liking, that's all.
Okay, good. All right, well, thank you. Thanks, Bob. And,
thank you.
Thank you for watching Chautauqua Books.